Osteoarthritis, or OA, is a chronic, debilitating disease that's increasing in prevalence. By 2030, there are projected to be 67 million adults living with OA in the United States. The cost to treat OA is also extremely high. Annually in the US, we spend $185 billion treating osteoarthritis. In a normal, healthy joint, there's a layer of cartilage that lines the two bones and acts as a shock absorber for the joint. There's also meniscus tissue present that helps decrease the amount of friction between these two bones. And there's also synovium, which is a membrane that lines the joint and provides lubrication. These tissues work together to allow for free movement of the joint. In a diseased osteoarthritic joint, there's a loss of this cartilage layer between the two bones, and there's also expansion of the meniscus and the synovium tissues into the joint space. These changes cause both an increase in chronic pain for OA patients and can also decrease their joint mobility. Current treatments for OA, however, are strictly palliative, do not halt disease progression, and cannot regenerate any of the cartilage that's been lost. Aging is one of the greatest risk factors for OA development, but reasons behind this are both unclear and understudied. We do know from other age-related diseases, such as Alzheimer's and diabetes, that there can be chronic low-grade levels of inflammation present within aged tissues, a phenomenon becoming known as inflammaging. And when we look at aging in a mouse, we can see that as mice age, they show increased levels of inflammatory signals within their cartilage. When we look at human OA patients, we also see that they show increased levels of this inflammation within their affected joints. We want to understand the role of the cartilage in this inflammatory process that occurs during OA development. Thus, my thesis project uses a mouse model to activate canonical NF-kappa B signaling specifically within the cartilage cells. Canonical NF-kappa B is a set of proteins within the cell that can act as a master regulator of the inflammatory response and promote inflammation. These mice show development of osteoarthritis at a rate 4 times as fast as their control mice. And this shows both cartilage degeneration in these mice as well as expansion of the meniscus and the synovium tissues. I'm currently focused on trying to understand exactly how canonical NF-kappa B can promote these changes that are consistent with osteoarthritis. Thus, we believe that inhibiting canonical NF-kappa B signaling within the cartilage could be a novel therapeutic approach to help combat the devastating effects of osteoarthritis. Thank you.